Today we are discussing coming up with an appropriate research topic in nursing and midwifery. Hi there, I hope you're doing well. I hope that everything is going well for you. Welcome to Elevate Nursing. Here we explore and share professional development resources for nurses and midwives, both students and practitioners. Today we're looking at coming up with an appropriate research topic. And research as it is a major facet of healthcare is that it serves as evidence, it serves to inform practice in terms of with any decision that is made in healthcare, there has to be a rationale behind it, and this rationale ought to be evidence-based. So this is the basis of research, and this is why it's a it's a paramount facet of healthcare. And as we get into research, one of the goals of research is to solve an ongoing problem or a known problem, to identify a problem or a challenge. Another goal is to augment current practice. That means to improve it in a particular way or to amplify the significance of a particular practice, technique, method, and so on. Something else to do in research is that you explore the current challenges that are available, that are present rather. And it could be a broad one or it can be very specific. But as we think about coming up with research topics, you ought to be extremely specific in terms of it has to be a smart, the outcomes ought to be measurable. So one of the things to do when you're coming up with a research topic is to think about PICO. PICO is an acronym of PICO, and the acronym that is PICO is the population, P, I is for the intervention, C is for the comparison, and O is for the outcome, an outcome that is measurable. So this is why we say that the outcomes ought to be smart outcomes, they ought to be measurable. So that, with that in mind, some of the ways that you can come up with a specific, with an idea, or one of the ways that you can look for ideas to come up with a research topic is one, looking at your clinical area. And this is one of the things that you realize is true when individuals who have had experience before advise that you have a bit of clinical experience before going in to do your master's or going into research. Based on your clinical experience, you're able to identify where the challenge is. And from that, you're able to creatively think about solutions or possible solutions based on your own experience. So look at the clinical area that you are working in. A second thing to do is read more on previous research papers that have been published or that are yet to be published. From these, you can gather the thoughts and the ideas that have been put out and the previous challenges. So you ask yourself, if this was a challenge, let's say in the year 2000, and we are now in, let's say, the year 2020 or 2021. So by that time, there has to be an evolution in healthcare. So what is the status of that challenge from that time to now? Have there been improvements? Have the recommendations of this study been implemented or not? What were their recommendations? Did they say, we need to work more on this area, we need to do more research in this particular area? So from that, you can pick on that and get more ideas on what you'd like to research on. So the second one, as we've said, is looking at reading more on previous studies. Third thing is communicating with individuals within healthcare. So let's say you're interested in accident and emergency, for example, or if you're interested in global health, let's talk about global health. If you're interested in global health and your perspectives are in a particular area, let's talk about non-communicable diseases, for example, or malaria, for example, yet you're working in an area where you might not have had a lot of experience in malaria, or you do not have hands-on, let's talk about that, you don't have hands-on experience when it comes to malaria. So when you talk to individuals who are working in malaria endemic areas or individuals who have had first-hand experience with malaria in terms of research within global health in different parts of the world, you'll get more input on the needs in these areas, and therefore that will guide your thinking better towards a particular topic or a specific topic. So that's the third idea is to talk to colleagues and individuals who have experience in these areas. Fourth, idea on how to come up with a research topic is to look at your own experiences, your individual experience. And one of the best things about looking at your personal experiences is that you're going to come up with ideas that are very specific, very particular to your own creativity, and they are reflective. It becomes rather easier. What am I trying to say? It's easier to come up, not easier, because you have taken quite a long period of time to internalize specific concepts based on your own experience. It becomes easier to come up with a research topic. Yes, that's how it is. So as you go into the clinical area, if you're graduating, if you're yet to graduate, if you have just graduated, even as a student, all the things that you do within the clinical area, put those together, identify challenges that are within these areas, identify gaps and needs and so on. And from that, you will get to internalize gradually and problem solve gradually. When you get to the instance where you would like to come up with a research topic, it becomes absolutely easy and it comes naturally to you. And that from that you can explore all the options you have as you're getting into the clinical area. So let's talk about, for example, wound dressing. If you have a challenge with wound dressing, so we have septic wounds, for example. So think about as you talk about septic wounds, think about modern techniques that are being used, such as the sterilized maggot system. From these, if you're working with nurses and healthcare providers that are concentrated in this area, you get to interact with them more. They get to tell you, oh, I did this a few weeks ago and this wasn't really working, and I see gradually that this is coming. This is working better. Talk about sterilized maggots, but this one isn't working for this patient. So you get to look at those concepts gradually. Sterilized maggots are working for this patient. What are the variables related to this? What are the ages from this that I have seen are applied? Sterilized maggots are applied. Talk about an adult age. So what happens with pediatrics? You see, gradually you start questioning the practice, and you have clinical providers with you that you can talk to about these things. So the experience is quite significant. So that's why I say it's really important to reflect on your own experiences, to question concepts gradually, and to be intellectually curious. That's one of the most important things to think about when you're getting into research. And even you don't have to come up with a research topic immediately. Take your time, brainstorm as much as possible, combine all these ideas, and I'm certain that you'll come up with an appropriate one for the area that you're interested in researching in. So that's that for today. These are ideas that are quite personal from my own experiences, and we have put together more and more ideas, and I'll be sharing a link with you of that in the description box. That will take you to our home base, that is elevatenursing.org. There we put together all our professional development resources from different nursing specialties. And from that, you can find more ideas on coming up with a research topic. All in all, I hope that everything is going well for you. I wish you all the absolute best as you work towards coming up with a research topic and your research processes. All in all, have a lovely day. Take care of yourselves. And until next time, Elevate Nursing. Cheers. Bye.